Okay, Bismillah Rahman Rahim. Start with the name of Allah. Today, our lecture is about drug interaction. So, what is drug interaction? Drug interaction can be defined as whenever we are going to administer two drugs concomitantly, or whenever we are going to administer two drugs at the same time. So one drug will enhance, increase, decrease, or cancel the effect of one another. And in other words, drug interaction can be defined as the drug interaction can be defined as the pharmacological activity of one drug is changed or altered by the concomitant use of another drug or by the presence of some other substances. It's called drug interaction. So drug interactions can be defined as, in other words, that drug interactions, let's suppose if you are going to administer two or more than two drugs at the same time simultaneously, so one drug will increase, decrease, or cancel the effect of one another. So this is called drug interactions. Next, drug interactions, the drug whose activity is affected by such an interaction is called as a object drug, while the agent which precipitates such an interactions is referred to the precipitant. So this is the main point which I have mentioned here, that what is the object drug, and the second one is precipitant. So we will discuss the next topic on that, on object drug and precipitant. Now, what are the types of drug-drug interaction? So there are different types of drug-drug interaction. The first one is drug-drug interactions, or the second one is drug-food interaction, chemical drug interaction, drug laboratory test interaction, and drug disease interaction. So there are 5 different drug-drug interactions which I am going to explain in the next lecture. The net effect of a drug interaction is generally it is quantitative. So it means, for example, increase or decrease the effect. So as I have mentioned before, that whenever we are going to use two drugs at the same time, so it will increase or the effect or decrease the effect of one another. The second one is seldom qualitative. Seldom qualitative means, for example, rapid or slower effect. And the third one is precipitation of newer or increase adverse effect. So these are the net effect of the drug interactions. Drug interactions are thus mostly undesirable. So there are some interactions which are predictable, and some reactions, some drug-drug interaction which are unpredictable. So unpredictable reactions, we know, for example, whenever two drugs they are used at the same times, and then after that what are the different type of changes and modifications which we can observe here. So mostly they are unpredictable, you can say undesirable. Rarely they are desirables, or you can say beneficial. So drug-drug interactions, it may be rarely desirable or beneficial. For example, here there occurred the enhancement of activity of penicillins when administered with probenecid. So I can give different type of example of drug-drug interaction. So I will discuss it in the. These are the factors. Now, what are the factors that contributing to the drug interactions? What are the factors which play a very key roles, especially which are the contributing factor to the drug-drug interaction? So the first one is multiple drug therapy. The second one is multiple prescribers, and these are the contributing factor which are responsible for drug interaction. So multiple drug therapy, multiple prescriber, multiple pharmacological effect of drug, multiple disease or predisposing illness, poor patient compliance, advancing age of patient, and drug related factor. So these are the 7 factors contributing to the drug interaction, as I have mentioned. These are 7 in numbers. Now come toward the mechanism of drug interaction. So there are basic there are 3 mechanisms by which we can interaction can be developed on the basis of these parameters. These are the points. This is the mechanism, this is the fundamental, you can say, the mode of action or mechanism of action of the drug interaction, that how these drugs can interact with one another and what type of changes can take place. So the first one is pharmaceutical interaction, the second one is pharmacokinetic interaction, and the third one is pharmacodynamic interactions. Now I'm going to discuss about the pharmaceutical interaction. Now, what is pharmaceutical interaction? So pharmaceutical interaction can be defined as, this is also called incompatibility. Incompatibility mean when two substances that doesn't match each other's, mean they are incompatible, so they are not compatible, they are not matchable with one another. So in simple words we can say incompatibility means which are not matchables. So it is a physico-chemical interaction that always occurs when the drugs they are mixed in the NIV infusions. Let's suppose we are going to mix different type of infusion injectables which causing precipitation or inactivation of the active principles. I can give you a different type of example. As usually drug interaction, there are 2 types. So the first basically the drug interaction, there are 2 types. One is exogenous drug interaction and the second one is endogenous drug interaction. And endogenous drug
interaction, it is always we can see the profile of pharmacokinetics. So in this case, an endogenous drug interaction, the type of drug interactions which is occur inside in your body, and you can say in view, which is occur inside in your body, that is called endogenous. And the second one is exogenous drug interaction. So in exogenous drug interaction, the interaction of 2 drugs, they occur outside the body. For example, so this is the classical example, it's called pharmaceutical interactions. This is the type of physico-chemical drug interaction which is always occur when the drug they are going to mix in IV intravenously infusion, which causing precipitations, activation or inactivation of the active principle. For example, let's suppose pharmaceutical interactions mean, for example, the ampicillin, or you can say chlorpromazine and barbiturates, they interact with dextrane in solution and they are broken down or from a chemical compound. So this is the classical example of the pharmaceutical interactions. If this ampicillin or chlorpromazine and barbiturates interacts with dextrane in solution and they are broken down or form the chemical compounds. The second one is pharmacokinetic interaction. So we know pharmacokinetic means what the body do with the drugs. As we know that pharmacokinetic, this is the general formula for the pharmacokinetic. ADME mean absorption, D mean distribution, M mean metabolism, and E mean excretion. So these are 4 steps. So pharmacokinetics set involve 4 steps mechanism. So pharmacokinetic interactions can be defined as these or that type of interactions. These are those interactions in which the pharmacokinetic properties of the object drug is changed or altered by the precipitant, and hence such interaction are also called what? Pharmacokinetic interaction: absorption, distribution, metabolism, and elimination. While the resultant effect is change the plasma concentration of the object drug. So as we know that inshallah I will discuss a little bit about that what is plasma concentrations. So inshallah I will discuss this thing and when in half life of drug. So these are classified
into different categories. Pharmacokinetic interactions, it can be categorized into different categories like absorption interaction. So the first one is absorption interaction, the second one is distribution interaction, the third one is metabolism, and the fourth one is excretion interactions. So in pharmacokinetics we will study that how the drug will absorb and how the drug will be metabolized in the body, and then how it can be transferred from one place to another place, and then how it can be eliminated from the body. So these are the 4-step mechanisms. So so now we will talk about the absorption interaction, that how the absorption is take place. So absorption interaction are those where the absorption of the object drug is changed. So as we have discussed about the object drug, that how the absorption of the object drug is changed. So in previous lecture we have already discussed about the you can say drug that when the drug whose activity is affected by such an interaction is called object drug. So we have already discussed about the object drug, that how its activity can be changed and the net effect of such interaction. What will be the net effect, that when there is interaction occur at the level of absorption, that how what will be occurs when the drug is absorbs in the body. So actually these are those where the absorption of the object drug is changed. So how it is changed, how the absorption of the drug is changed. So the net effect of this interaction, it may be faster or slower the drug absorption. So there will be two type of changes occur. Either the absorption will be fast, or either the absorptions will be, you can say, slow. So there will be two phenomena occur here, more or less or complete, or you can say complete drug absorptions. The absorption will be faster, or either it will be slower one, or it will be more or less. So there are 4 different type of parameters, that the absorption will be faster, slower, less, or complete absorption. Now this is the major mechanism of absorption interactions. These are the major mechanisms of the absorption interaction, that how the when the drug is absorbed and what type of interaction is occur. So there may be, first of all, so there may be complexation and adsorptions. Absorption, adsorption mean when there is when something they are absorbed on the surface. So surface absorption is called adsorption, and complexations mean when there is some, you can say, complex signs are formed. For example, let's suppose tetracycline, if it is used in a combination with milk. So definitely, as we know that milk contain milk of magnesia, and then milk it form insoluble complexes ions. So it may directly or indirectly absorb, it may directly or indirectly reduce the absorption of that particular drug. For example, let's suppose tetracycline, the absorption of tetracycline will be decreased by milk, because milk contain, you can say, milk contain milk of magnesia, and this milk of magnesia, so it will form insoluble complexes, and due to these insoluble complexes, it will directly decrease the absorption of that particular drug. There may be chances of alteration in the gastrointestinal pH. So the normal physiological pH is 7.4. As we know that alteration in the gut motility, and there is occur inhibition of the gastrointestinal enzymes, and there may be, you can say, alteration of the gastrointestinal microflora, and the sixth one is malabsorption syndrome, insufficient absorption. Now look at here, this chart. This is called object drug, and these are precipitant drugs, and these are what are the influence on the object drug. So what are these? So here, look at here, absorption interaction. The first one is complexation and adsorption. So as we have discussed about the complexation and adsorptions, that how it is take place. So this is called cephaloxacins. You can say cephaloxacin, and you can say phenylethylamines. So if the
these drugs, they are used in a combination with the antacid food, mineral supplements which containing aluminum, magnesium, ferric, zinc and calcium iron. So after interaction of these drugs with the food antacid mineral, so what will be happen? So as a result of, there will be formation of poorly soluble and unabsorbable complex with such heavy metal ions. So there are many drugs there are, and then interaction can be considered. So there are you can say there may be major interaction, or you can say minor interactions. So on the basis of that, then we will classify it into different categories. The second one is how the alteration of gastrointestinal pH occurs. So this is what sulfonamides. So as we know that these are antibiotic, while you can say aspirin and ferrous sulfate, if so they are used with the antacid and you can say sodium bicarbonate and calcium carbonate, because we have discussed how, as we have discussed that two drugs, they are going to interact with one another. So what will be happens when they are used in a combination? So it will enhance the dissolution and the absorption rate. It will directly increase the dissolution and absorption rate. So it also come under the category of drug-drug interaction, and it can also decrease the dissolution and hence absorption. So it means that it may directly affect, the dissolution rate of the drug. So when the dissolution rate of the drug, or you can say the absorption rate of the drug, it becomes decreased, so it means definitely the bioavailability of the drug will be affected. So and next classes inshallah I will explain about the bioavailability, bioequivalence, therapeutic equivalence. The third one is alteration of GUT, gut motility. So here this is aspirin, diazepam, levodopa and maxilitines, and this one, if these drugs are used in a combination with metoclopramide, so what will be occur? What type of changes will be occur? So it will cause rapid gastric emptying and increase the rate of absorptions. Here the levodopa and lithium carbonate and maxilitines, they are in a combination with anticholinergics. So as a result of, so it will delay the gastric emptying, and you can say decrease the rate of absorption. So it means these are opposite of one another. So you can check it here. In this case, there happens rapid gastric emptying. So while in this case there occur delay gastric emptying, while in this case the absorptions rate is higher, and here the absorption rate is slow. Now once again, this is the object drug, and this is the precipitant, and this is the influence of the object. This is called, the fourth one is alteration of the gastrointestinal you can say microflora. So this is digoxin. You know digoxin is basically it is extracted from the Digitalis lanata, and digoxin, this is the drug which is used in the treatment of what? It is used in the treatment of congestive heart failures. So if digoxins, if they are used in a combination with the you can say antibiotics, so this is you can say this is the object drugs, and this is the precipitant drugs, and here what will be the influence on the object drug? So it means what will be the influence on the object drug? So it will directly increase the bioavailability due to destruction of the bacterial flora that you can say inactivate the digoxin and lower intestines. The fifth one is malabsorptions. You know malabsorption means insufficient absorption syndrome. So for example, this is object drug, for example vitamin A, which is called retinol, vitamin B12, cyanocobalamin and digoxin. So if they are used in a combination with neomycin, and neomycin is actually precipitant drugs, so it will directly inhibit the absorption due to malabsorption. It means that the absorption rate will be decreased. And after that we shall talk about the drug-drug interaction at the level of distributions, elimination and metabolism inshallah in my next lecture.